What do you think of when you hear the words food insecurity? Knox County Health Department Community Health Nurse Susan Yocum is here today to talk about local food shortages. Thanks for joining me today, Susan.
Thanks for having me.
So recently there was a study done by the IU O'Neill School of Public and Environmental Affairs in conjunction with the Knox County Health Department. How did that start?
Last year, when I had first started with the health department, I attended the IU Rural Conference and sat in on a breakout session with Dr. James Farmer. And it highlighted the Sustaining Hoosier Community Program through IU, focusing on food security and insecurity in another community. And it just highlighted all of the resources that IU had to offer. So after the conference, I sought out a few of the contacts that I had made there. And we did a couple Zoom calls with some of the staff with the School for Rural Engagement. And they set us up with Dr. Farmer's class. And we kind of landed on our food pantries within Knox County. I've been in healthcare for a long time and have seen that we do have a lot of pantries available, but sometimes the accessibility is not really great. Sometimes there's limited staffing, limited resources, selection, and I had thought that if IU could come in and help with their resources to maybe help us get a little bit more organized and collaborate, that we might be able to provide a little bit deeper and better system within our county.
Right, so they came in, and how long was that study they did?
So I believe they started in January with this semester. It's a group of his master leveled students, and we had a couple Zoom call meetings with them, and then they set about doing this collaborative with our food pantries. They started with an assessment by contacting our local food pantries with questionnaires, finding out some of their challenges, what they offer, things that they might need, and from that assessment, then they identified some other ways that they might recommend to us to help with this project.
Right, and so what were some of their major findings? I know the final report's not out yet,
right,
but what did they find?
We should get the final report in a couple weeks. They did find that we are fortunate that we have a large amount of pantries. We do cover most of our county, but they did find that down in the Decker area and in the southwest part of our county, there is a higher rate of poverty level individuals, those that are getting WIC and SNAP and some of the other things that are offering through the state and through our local community. So they identified Vincennes and Decker and I believe Widener Township as areas that we might be able to add a little bit more to help the individuals in those areas.
Right, and I think that was available to watch for the public, correct? Their findings. If someone wants to watch that now, where is that? Where can they watch that?
So I do have that, the session that they held last week, through a link, and if you'd like to email me, I'd be happy to send that to you. I invited a lot of community members, and many were able to attend that day for the final project, but I do have that entire, the presentation that they offered, and they can just, if anyone's interested in watching it, they can email me, and I'd be happy to send that to them, especially anybody that I might not have reached that didn't get the opportunity to attend, because we're hoping to take some of their recommendations and suggestions and move forward with this.
Right. How did our access to food pantries compare to other areas in Indiana?
Honestly, I'm not clear on that. I don't know how they compared us. They just basically told us about the percentage they looked into the data and the percentage of our poverty level, the percentage of people that might have a language barrier, transportation barrier, some of those kinds of things.
Right.
But they did make several comments about that they were surprised at the amount of opportunities that we do have, although they did identify some barriers like weekends and evening hours for the public.
Right, and I know Knox County covers such a large area, so many of the, like you mentioned, Widener Township and Decker, the outer reaching edges, it's up to churches and volunteer groups in those areas to set up blessing boxes and things like that. But even then, transportation still remains
Sure.
An issue, because I know the trolley in Vincennes, I think that has helped probably, people in town access the food pantries better. But like you said, the studies sometimes found maybe they weren't open on the weekends, or maybe they weren't open on evenings. So if they were working and trying to get there, but so many of these are just volunteer based,
Right.
so that's what makes it so
And it's
hard.
an aging volunteer base. They did
Right.
find that the average age of the volunteers at our food pantries is around 50. And so they did identify some opportunities where we might potentially get some younger people in that might be able to identify or might be able to offer some of that evening or weekend, looking at maybe mobile units that might be able to go into these more remote areas, or looking at providing some of these churches or local community centers with more resources.
Right, and I think so many of it, like you said, it has to be volunteer based, and it has to come from the community, just because so many of, especially federal grants, state grants, are getting cut, but food costs are certainly not going down. So the people who were needing food before are still going to be needing food, and so it's just figuring out better ways to give them access to that food, right? And I know, this has nothing to do with the health department, but Sunbucks has been cut back. Indiana decided not to participate in this year, which was basically extra money for kids during the school year or during the summer to access food. When there's not enough food in a community, or there's not enough access to food in a community, what effects from the health department point of view do you guys see?
So we've all heard about all the cuts everywhere, and that is a huge concern, especially for the summer months. Our students do depend a lot on the breakfast and the lunches that are served, and I know that some of the other food programs are still going to go on, but those extra Sunbucks, I think that we'll see an increase of people needing these extras through food pantries and food banks, and we need to be able to be ready for that and to address that. Good nutrition across the board is the key to a healthy community. We at the health department, we do offer some produce vouchers that we provide to some local organizations like FHC and some of the trustees and through our immunization clinic, and they do offer some free fruits and vegetables at our farmers markets in a couple locations within the community. In order to help, we anticipate that to be on the rise as well this summer, but if we don't keep our kids and our elderly healthy, we're going to look at more chronic disease and more emergency room visits, that kind of thing.
Right, and I know you guys have been working more to educate the public and to educate the youth on healthy eating. What are some events that you guys have done lately?
Well, we do have Fit Kids that goes into the schools and talks a little bit about My Plate and healthy nutrition, as well as the importance of activity. I've done some things in the summer at some of the different summer camps and such. We joined with 1972 a while back for National Nutrition Month to try to get kids involved. At Ag Day, we planted seeds and gave out some information about healthy eating and trying to get kids interested so that they can potentially influence their parents on, instead of getting the colorful cereals, we get the colorful vegetables.
Right, and those kids grow up to be adults.
Sure.
So then we hope, starting with the youth, then we can maybe start to change some of these
chronic
shifts.
disease is starting younger and younger, so if we
Right.
can start alleviating a little of that in our younger population, hopefully that'll help in the future.
Right, so was there anything specifically that this study, kind of looping back around to the study, just to finalize the specific needs?
Other than some collaboration and some extra hours, they did talk for quite a bit on a food council, something that would band all of these organizations together so that we can collaborate and share our resources, share our volunteers, make sure that we're hitting the population that is most in need, and not necessarily anything that is something that would represent everyone involved in this. So council sounds a little bit formal, but something that would keep this moving forward, and so that we can continue to improve on focusing on the food insecurity that we have in our community.
So if someone is interested in getting, involved in that council or committee, who would they need to contact?
If anybody is welcome to call, and I can be sure to get them hooked up with the right people or give them that video if they're interested, they can call the health department at 812-882-8700 and just ask for Susan.
Well, thank you so much for joining me today, Susan. This was all very important information, and I appreciate hearing about it.
Thank you so much for having me.
Again, if you have any questions, you can contact the Knox County Health Department at 812-882-8700.